Doctor, what are the diagnoses, how we can diagnose this one, and how we can treat this one?
So, a simple way of diagnosing ITP is actually getting to know what is the platelet count. That is called complete blood count, where we look at what are the counts at. So, what is our hemoglobin, what is the platelet count, what is the WBC count, and also a test called peripheral smear, where we look at the blood under the microscope and assess for what are all the different variations in our blood picture. Do all the cells look okay? In ITP, we see large size platelets, so that is actually a very corroborative evidence that this is ITP. Apart from this, a lot of the other part of diagnosis is actually where we rule out other disorders or other diseases. There should be no production issues of the platelets. There should be no medications that is causing the platelet counts to go down. There should be no illness. So if the patient has a very high fever or a viral infection, usually that can cause low platelets as well, but then we don't call it ITP. So there are different things that we need to rule out before we say that a patient with low platelet count is actually ITP. One of the tests we do to help in diagnosis of ITP is called bone marrow aspiration biopsy, where just like doing a blood test, we take blood from the vein and check, if the counts are okay. We take a small sample from the bone marrow, which is the spongy area inside the bones, and we send that for testing to see, okay, is there any other reason for the platelets being low, or is it just ITP? And we have reduced the number of times we do this bone marrow aspiration biopsy. It is not indicated for all patients unless there is a strong doubt, okay, this may be either ITP or condition A, B, or ITP. So there are still some things that are not completely clear just with the history and the medication and the preliminary blood test. So in those scenarios, to clinch the diagnosis, to finalize the diagnosis of ITP and rule out other things is what we do a bone marrow aspiration biopsy for. Sounds like a very scary procedure, but it's actually a very short procedure that takes only about 5 to 10 minutes and can be done in an easy OPD or a daycare setup as well.
So what are the treatments for ITP?
It's mostly medical. So previously it used to be a big surgery called removing spleen, which is an organ in the left side of our abdomen. But that is true maybe about 20 years ago when we did not have all the latest medicines we have these days. So now we have medicines. Usually the first line we use is steroids. Some patients can be resistant or refractory to steroids. In those patients, we give what is called IVIG, especially when the platelet counts are very less or the patient is bleeding and we want their counts to improve. We give these two medicines up front. There is another medicine called anti-Rho or anti-D injection that also improves the platelet counts. Comes with a little more side effects, so it is not very preferred these days. Apart from this, we give immunosuppressants. So as I said, ITP is a condition of hyperactive immune system that is destroying the platelets. So we give medications called Azuran, MMF. We also give this injection called rituximab, which is actually some sort of an immunosuppressant as it removes the cells that attacks these platelets or makes these antibodies that attacks the platelets. So this rituximab injection has been shown to have the best track record, as in if you give 4 proper full doses of rituximab for ITP, usually maintains the platelet counts above at least 70,000-80,000, a lot often more than 1 or 1.5 lakhs for a longer duration of time, almost up to 2 years. But rituximab should not be given by anybody and everybody because rituximab comes with its own side effects. It's a medicine that can cause reactions. So it has to be, judged or appropriately diagnosed, and then the patient has to be considered fit to receive rituximab, failing which it can also cause a lot of side effects in the longer run. And in the end, recently we've had these 2 medications available, which was mostly available in the West, but we have this medicine called romiplastim and L-Trombopag. Romiplastim is an injectable form of the medicine which increases platelet counts in the bone marrow, and L-Trombopag is another medicine which is in the form of a tablet that also helps improve platelet counts and bring it up to desirable levels. And these medicines can be used in the longer run, but again that judgment has to be made by a specialist because again they both come with some of their own side effects, and only those patients who can tolerate those side effects or are not going to be affected severely should be started on those medications. Last but not the least, surgery, which was one of the highest recommended procedures for ITP in the past, has now gone down way below in our list because of availability of all these medications. That surgery is called splenectomy, where spleen is removed. So spleen is considered the organ where platelets are destroyed actively. Once the immune system attacks it, the spleen just removes it out of the blood. So if you remove the spleen, platelet counts tend to be much higher. But splenectomy again comes with its own side effects, which is increased risk of thrombosis, of increased risk of blood clots in the body, and also causes you to have more infections. So spleen forms a part of our immune system. So if you remove it, then there is a higher risk of definitely viral and bacterial infections going forward. So that that is why splenectomy is now one of the last indications for treatment for ITP, when all these medicines have been exhausted and most of them have not really shown any effect. The patient is refractory to all of these. That is when splenectomy is recommended.
Thank you, doctor, for giving update on ITP.
Thank you.